Hello guys, welcome back to the channel. It's Unit 3 Part B. The head circumference. If you take a tape and if you measure the circle of the head of the baby, it will be around 35 centimeter. If you check the baby's chest measurement, it will be around 32 centimeter. See, the baby's head is bigger than the chest, but we adult, we have a smaller head and big chest. Okay, at the birth the head will be 3 centimeter larger than the chest. From the crown to heel, that is from the head to foot, the whole measurement will be around 51 centimeter. This is not perfectly 51, it will be around 51, that is either more or less. And at the birth the weight should be around 2.5 centimeter. Then the baby is considered to be the healthy baby. Apart from this, we know what is the respiratory rate is. It is from 40 to 60 breath per minute. And we know what is the heart rate is. It is from 120 to 160 around beats per minute. And we even know what the BP measure is. At the time of birth, the BP will be around 80 to 50 mmHg. After the birth, daily assessment should be done, like is there any problem related to skin or a respiratory problem, any pain in the head, or any irritation seen in the eyes, bleeding from any spot, mainly in the umbilical cord, and if there is any reddishness, anything like if there is any problem in any ear, nose, mouth, we need to keep checking this regularly. And at the birth, there may be these three things that is seen in the skin. If there is any pinkish kind of mark, it is generally in the form of line, but even in small children's, in few babies, it is also seen in the form of circle way. But this streak bite is generally red in color. If you see any kind of reddish dispatch in the baby, it is considered streak bite. If there is any bluish or greenish discolor, mainly around the spinal cord, this is mainly around the spine, then it is known as Mongolian blue spot. It is generally blue in color, but generally in few babies it is even seen in greenish color. If there is any red or purple discoloration in the face or any other body part, it is known as port wine stain. If there is pinkish color, it is streak bite. If there is any bluish or greenish color, it's Mongolian blue spot. If there is any purplish or reddish stain, it is port wine stain. Essential newborn care or thermal control. Soon after the birth, the baby is cleaned properly and sterile method is followed. That is very important. And hygiene is the first measure to be taken to the baby after the birth, because baby is very sensitive. There is lots of chance that baby might get infected very fastly. So prevention of infection is the primary source. Next, after the birth of the baby, after cleaning the baby, we need to take care the cord care, and this care should be taken every day. That is, after cutting the placenta, we need to clamp them, and after clamping we need to check it regularly whether there is any redness or any kind of bleeding there. Initiation of breathing is checked. That is, after the birth, make sure the baby has came across its first cry, that is baby has cried very loudly. If there is any problem in that first cry, there will be a problem in breathing. If there is any problem in breathing, we take a measure called resuscitative, and this is nothing but placing the baby in the ventilation. Thermal protection. There is a risk of hypothermia, in the sense there is a chance that baby's body temperature will get too low, because inside the womb the temperature is very warm, whereas the after the birth the baby comes out and here the temperature is very cold, so the baby's body temperature will fall down. To maintain that, we need to wrap the baby very quickly after the birth and then place the baby in a warmer. And very important thing is, we do provide a skin to skin contact with its mother. That is, Baby is very familiar to its mother. Baby responds to its mother cell. After the birth, it feels very strange in this environment. To make sure the baby is very comfortable, we will make sure the baby is placed over the chest of the mother, and there is a skin to skin contact, and this contact is also known as kangaroo mother care. And this care helps in various ways, that is helping the baby to make sure it is comfortable and helping the baby to gain weight. This process will really help the baby to gain weight and helping the baby to maintain its temperature. This kangaroo mother care, that is skin to skin contact, is very important and it is performed. Breastfeeding. Soon after the birth, around 1 hour, the baby is make sure that the breastfeeding is provided to it, and we advise the mother to follow the breastfeeding around 2 years. For 2 years, compulsory the mother should provide breastfeeding to baby. For first 6 months, only breastfeeding is provided. Only the breast milk should be provided to the baby. After 6 months to till 2 years or 2 to 3 years, with breastfeeding, we will provide other kind of complementary feedings like complementary foods. With that, we provide cerlax or any kind of smashed rice with some water. Like that, we provide the food. Eye care. Why especially eyes is protected or cared in the sense it's a vital organ and it is exposed outwards. After the birth, the chance of getting infection is very high, so make sure the eye is also protected. And next, immunization. Soon after the birth, within 1 week, that is after the birth, it is BCG is provided. If not within 1 week, we need to provide BCG vaccine to the baby. And hepatitis B is also provided after the birth. And next, OPV and HBV are provided. In the next immunization schedule, you will see when to provide and how to provide, in which site to provide. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.